Good morning. I'm Linda Parks. I'm on the Board of Supervisors, and it is an honor to be here today to welcome you to this wonderful conference being put together by the Ventura County Area Agency on Aging and the Ventura County Elderly Fall Prevention Coalition. It is so important to do what we can to prevent falls because they could lead to serious injury and actually spiral into a situation where people will die because they had a fall. So we want to make sure that we can do all we can with our different government agencies and our different collaborators to ensure that we make an environment that is safe and free from people tripping and falling. I feel like the present Linda Parks will be good for the future Linda Parks if I can make sure that what I do at my home makes it safe so I don't trip and fall. And I know that's something that we can all do. And these great folks coming together today can provide us some wonderful information on this. You know, back in the day, before COVID, we used to put on senior summits where we'd bring some 350 seniors together at Cal State University, Channel Islands. And one of those, the theme was "There's no place like home." And that was one of my favorite themes of all the senior summits. And we had workshops focused on home and housing issues for seniors, and so they can age in place. And one of those was to ensure that we don't have tripping hazards in the home. And we called that one "Staying in Your Ruby Slippers." I just thought that was such a good idea with this whole theme of Dorothy and the Wizard of Oz. But it is really important that we make sure that we don't have tripping hazards. And I welcome the information we will be getting today. I also want to just take a moment to remember one of the best champions we had in Ventura County, and that was our chair of the board, Carmen Ramirez. You all probably know that she was hit by a truck in a crosswalk, so you just realize that how life can be very precarious, and we want to make sure that we can appreciate those around us. And that, to me, with Carmen's passing, the one thing I want to do is do what I can to carry on for her. And she was so dedicated to senior citizens and this fall prevention efforts of the county. I know she brought that to her communities in Oxnard, and something she felt very strong in. So it gives me particular happiness today to be able to carry on just a little bit by encouraging you all to take all the information that you'll be gathering today and make sure you live as wonderful a life as you can, because it can be very short. I thank you all for being here today. I want to thank those putting on this wonderful workshop for you all, and live life to the fullest. Thank you.
Hello, my name is Thomas Duncan, and I'm the coalition leader of the Elderly Fall Prevention Coalition. And I want to thank everyone for joining us this week for viewing this session. I'd like to first give thanks to Supervisor Linda Parks for being involved in terms of our opening remarks, as well as highlighting a very special loss that we've had this year. On August 12th, we lost Supervisor Carmen Ramirez, who was an icon in our community, and she was a partner of a fall prevention coalition, as well as a partner to Ventura County Medical Center. So she will leave a big void, and we will truly miss her. Now, I also want to highlight the fact that we have Independence Day coming up on September 16th for the Mexican independence, and we're going to have some activities in regards to that. Throughout the week, we'll have different activities also. And including that will be our keynote speaker, Dr. Liu. Dr. Liu is a neuro-optometrist. We also have the Equilibrium crew from Equilibrium Physical Therapy that will show you how to get up if you fall or other mechanisms to prevent falling. In addition, we have our Grossman Burn Center crew that will be out here talking about ways and means of preventing burns from happening. And we'll have some fun activities like Zumba and Tai Chi, and also healthy eating habits on a limited budget. Now, we also have our promotores and y-promotores that will be involved in our process to give us some up-to-date information from their standpoint. And also, we have our techniques for relaxation, and all of that will go throughout the entirety of the week until we have a session on Friday, September 16th, a multidisciplinary session that will involve multiple specialties to answer questions from the community. So once again, I hope you learn a lot, and we truly appreciate all of you viewing this session. I'd like to welcome you to our Fall Prevention Forum, and we're going to be talking about how to prevent falls, and it's titled Farewell to Falls. First of all, I'd like to highlight the fact that we have our Independence Day coming up for Mexico on September 16th, and we truly appreciate our partners with Mexico in all that they do for us in terms of making our coalition function adequately. I have no disclosures. The only disclosure I have is the fact that I do not like falling, and I do not like people that fall because it tends to cause injuries that could be life-threatening to them. So the purpose of this forum are fourfold. Well, first of all, we want to bring awareness to our community about falling and the dangers of falling, as well as bring in resources from our community-based organizations about falls. And also we care about our community, and that's the reason why we're holding this forum, and also the fact that we need to prevent falls and injuries that come along with it. We lost an icon in our community on August 12th. Supervisor Carmen Ramirez was unfortunately killed on August 12th by a driver in a vehicle. Not the fault of the driver, but unfortunately we lost her, and she's a void that will never be replaced because of all the measures that she brought forth and the way she connected with our community in general, from Ventura itself to Oxnard in particular, and throughout the entirety of Ventura County. And so I'd like to have a recognition for her in terms of this. And the last time I saw her was in Thousand Oaks at one of our events. So let's talk about the what and the why of why we're doing this forum. First of all, I'm a physician and surgeon who is a part of an outstanding multidisciplinary organization, a fall prevention coalition that works in concert to prevent falls. And we want to prevent primary and secondary falls. Primary falls being those falls that we can prevent from happening in the first place, and secondary falls is falls that occur after an individual has already fallen the first time around. So we want to decrease the amount of complication that occur from falls. We've had this forum about 16 times now, if I remember correctly, and we go from all parts of the county, from one part to the other. Unfortunately, we're holding this forum in a virtual manner because of COVID-19, but we held a forum in Santa Paula a couple of times, in Ventura, in Simi Valley, Thousand Oaks, Camarillo, and Oxnard also a couple of times. So we've tried to infiltrate the entirety of the county to spread the word of fall prevention. Normally I give a story about my dad. My dad, Joseph Thomas Duncan, died 2 years ago on July 5th. Now, he took a fall. He took a fall when he was 80 years old, and the first fall he had did not cause any issues in regards to him getting up and about. But the second fall he had, which was about 3 months later, eventually caused him to have fear of falling because he had an injury that caused him not to be able to get up and about. As such, he eventually developed contractures, which are a stiffness of the legs or feet, and he couldn't get up. He had a feeding tube, and ultimately he died 6 years later as a result of this. His birthday is September 13th, which is tomorrow. In regards to falls, it's a very common phenomenon, and if you don't know about it in terms of not working in a hospital environment, you have no idea how often it happens. But because I work in a hospital, I know we have patients that come in over and over and over again for reasons due to a fall. And one thing that can help is having a fall prevention medical alert device. One of those could be a lanyard, or it can be placed on a belt or a wrist strap. And these days we have the Apple Watch. And I have no relationship with the Apple company, but they tend to work great. And if somebody has taken a fall, it automatically connects with the EMS system to alert them. So they're really helpful. And actually, my dad had this on when he fell the first couple of times and alert the EMS system. So life expectancy at birth and at age 65 in the United States in 2018 and 2019 are as follows. Males 76, females 81. So that's the average lifespan. In both sexes combined, it's about 78. And I just heard recently that the lifespan has gone down. In 2020, the lifespan went down to 77 for both sexes, and for both sexes in 2021, it went down to 76. So it's gone down based on the fact that COVID-19 happened. So as far as the 10 leading causes of death in the United States, it used to be heart disease, cancer, and then unintentional injuries, but with COVID-19, now COVID-19 has taken the third place, but unintentional injuries is the fourth place, and these kind of injuries are those that can be prevented, and those include poisonous deaths as well as motor vehicle crashes and then drowning. Now, falls are the number one cause of injury deaths and unintentional injuries, as well as hospital admissions in the elderly, and the amount of people that fall is astronomical. For example, we have about 36 million older adults, or those 65 and over, that fall in the United States per year. And out of those, there are 32,000 deaths over that year. Some other eye-opening statistics are as follows. Almost every 20 minutes, we have somebody that dies from a fall-related reason that's 65 or over. And every 11 seconds in the emergency departments all across the country, we have an older adult that's treated for an injury-related fall reason. The thing about this is, and why we have this coalition and target homes, is up to 70% of these falls occur in homes. So it behooves us to ensure that homes are safe for our elderly individuals. Now, about a quarter of these individuals, or 1 in 4 adults 65 and over, will fall each year. And that number goes up to 50%, or 1 in 2 adults over the age of 80 will fall each year. So as you get older, these falls get more frequent. The dollars and cents issue is also huge. Back in the year 2000, $19 billion was spent by the U.S. health system on falls alone, according to the CDC. In 2015, this figure went up to $50 billion, more than twice the amount. And then come 2020, it's gone up to $67 billion. So as you can see, the number is rising astronomically. Regarding falls in the United States, it used to be 5 deaths of elders per hour every time that we look at the hour clock. Now, this number is going to go up to 7 deaths per hour in the year 2030. So that number is going to go up by 2, and that's too many deaths that we have. So it's going to increase by 30%. We have a great facility at Ventura County Medical Center, and although we have this facility to take care of those that have both traumatic and non-traumatic issues, it behooves us to keep patients out of the hospital with injuries that are preventable, because falls are largely preventable. So there's something called YOLO, and some of you may know what YOLO means, some may not, but if you don't, it means you only lived once. So I came up with this statement: you only live once and you only die once. So live life and prosper, for only God knows when the inevitable moment will happen. So thank the Lord for every day, but for heaven's sake, protect thyself from falling. There are some reasons why individuals fall, and some patients are similar to my patients are similar to those, or the picture that you see in the top right-hand corner. They take so many medications that you wonder how they take them. But in a home, if somebody loves alcohol and drinks either a small glass or a large glass that causes them to be tipsy and they trip and fall, or use drugs that aren't prescribed, or even prescribed drugs, they may end up falling, and that could be a bad thing. Extension cords that go across the hallway could be a trip hazard, and then wrinkled rugs either on the edge or in the middle of the rug could be also a hazard. Clutter is a big deal, because there are some individuals that latch on to what they have throughout their life because they have sentimental value, and some of those clutter related items should technically be gotten rid of, but because they're in the hallway, they cause individuals to fall. And then falling out of bed. If the bed is too high up, then it can cause a big injury. Or if you have a side table that's so close to the bed, and when somebody rolls out of bed, they hit their head on the edge of it, that could be an issue. Floors that are wet, and that's a big one, because when you get into the shower, it's always great to be aware of your footing. And then small pets, even though we love pets, but these pets can sometimes be a hazard to us, and you have to be aware of it. And having footwear that's not properly fitted for you, and flip-flops could be a problem. Now, some medical conditions, and some of these occur as we get older, like cataracts or macular degeneration, that could cause your vision to be poor and subsequently end up falling because you don't see items in the hallway. Or lighting. Something as simple as night lights could save somebody's life, because an inexpensive night light could light up a hallway and prevent somebody from tripping and falling. And then dizziness that can occur with either inner ear problems or medications, or dehydration can cause an individual to fall. We used to say 5 medications or more, polypharmacy, could cause an individual to fall because the medications can interact. But realistically, if you're taking only 2 medications and they interact with each other, that could also be a hazard. And then mini strokes or poor strength, particularly in the lower legs. In the legs, if your strength isn't great, then you can trip and fall because you're not balanced properly. And we'll talk a little bit more about some balance-related exercises. And then dementia. My mom has dementia, and we have to keep an eye on her and have 24/7 care. Otherwise, she can end up tripping and falling. And vascular disease. In regards to hip fractures in the elderly, it's a huge problem. I mean, I can't tell you how many times I have somebody that comes into the emergency department, or I get called to see as a trauma patient because they've taken a fall and broken their hip. It accounts for 95% of fall-related injuries, and it causes about 300,000 injuries in the United States. So hip fractures are huge, and while the patient is in a hospital, they die about 16% of the time. It also causes a death in 30% of those individuals within a year from when the injury happened. So it's pretty astronomical. And we have a demonstration of a body wash. Now, I have no financial relationship to this, but it's a good way of taking a shower without having to stoop over, reach for soap, etc. And I hope you can afford it if you do, and have it installed in your house. But for those that can't install it, at least it's something to look forward to. So based on some data that we looked at in Ventura County, we found that there were silos occurring with our EMS or the paramedic system, and then hospitals, both the non-trauma and trauma centers, and then public and private agencies. And we realized that we all wanted to prevent falls from happening, and so we created a coalition to bring everyone together to talk about falls and how we could prevent it. And that way we created the Ventura County Elderly Fall Prevention Coalition. And here's a snapshot of logos of those involved in the coalition, and our board of supervisors have been great in terms of supporting our efforts, and we truly appreciate it. So if a senior has a fall and there's a 911 call for the fall, the paramedics come out to evaluate the individual, determine whether it's a true cause of a fall. And then some individuals do not necessarily need to be transported to the hospital, and they get either lift assist, which is lifting them into bed, and they have literature that's left for them. On the other hand, if they have to be transported to the hospital and it's an emergency, then all bets are off and there's no delay in making that happen. Some individuals that fall are taken to the hospital with their private vehicle. And then some data about the fall and how it happened is dumped into a big database that we created, and our fall prevention coordinator who lives at the Ventura County Area Agency on Aging will review the data on a daily basis and determine what services the individual needs. Either the individual needs home modification if the home isn't safe and they need grab bars or a ramp, or if a home health agency can come out to help out with these issues, they will. Public health nursing is also involved in terms of having the individual connected to a primary care clinician. And we have other community resources that are available that are offered to the patient if they need so. These are the flyers that are normally given to patients in the field by the EMS or even in the hospitals when they arrive. It shows you how to prevent falling and how to keep your home safe. And it's both in English and Spanish, and we truly appreciate the fact that we have these flyers given out by EMS, as they help us out quite a bit. We have evidence-based classes or programs, and these evidence-based classes are those that have been tried and true, meaning they work, they've been scientifically analyzed, and they truly help our citizens out. So we got 4 of them: Matter of Balance, Walk with Ease, Tai Chi, Moving for Better Balance, as well as Stepping On. And some of you may have been involved in these classes, and they truly work, so I encourage you to sign up for them if you have not tried them out already. Now, in terms of the data for fall prevention exercise classes or the evidence-based classes, we researched this and found that those that participate in the fall prevention classes, if they've taken a fall and they participate in the classes, they fall again only about 5% of the time. But if they do not want to participate, the fall rate is about 22%. So you can see there's a big astronomical difference between those that participate and those that do not participate. JAMA, in the Journal of American Medical Association, had an article published in 2018 by the United States Preventive Services Task Force. They have a recommendation statement that goes as such. They recommend exercise interventions to prevent falls in those over the age of 65 to decrease falls. So in terms of COVID-19 and the pandemic, and now we have monkeypox, but it's prudent to get the jab. We have the new jab coming up, hopefully within a few days from now, so it'll be prudent to get the immunization and the booster. Wear a mask in areas where it's recommended. I wear a mask all the time when I'm in the hospital or in my clinic setting because it's recommended to protect myself, to protect my patients. You want to move around more and sit less. And also you can partake in either video-based exercise classes or outdoor evidence-based activities. And that way you can increase your balance and strength. We have something called FOMO. FOMO is fear of missing out. So most of us have fear of missing out, but the most important thing or most important aspect of life is quality of life. To maintain great quality of life, it behooves us to enroll in evidence-based classes to acquire strength and balance so that a ground level fall is prevented and good quality of life is achieved. So here's a snapshot of one of our forums we held at the Oxnard Senior Center a couple of years ago when COVID-19 wasn't in effect. And we had about 300 or more participants. You can see they're participating in one of our exercise-based classes and having a great time. And we wish we could have been in the same situation to have the same event, but unfortunately with COVID-19, here we are. So we truly appreciate the Board of Supervisors supporting us and giving us a proclamation on a year-by-year basis, which they've done ever since the year 2013. And the next proclamation will be happening on Tuesday, September 20th. So we truly appreciate our Board of Supervisors and all that can show up from our team. We'll be there to take another picture with our esteemed board. So our main contact at our fall prevention program is 805-477-7343, and the email address is fall.prevention.program@ventura.org. So we truly appreciate you, and once again, thank you very much, and we'll be glad to answer questions on Friday, September 16th. Goodbye.